This is the Emergency Medical Minute.
I'm going to talk about a case I saw about a month ago. A fella came in with respiratory distress, COPD, and pneumonia. But that's not important, because what was important, this guy came in, he was absolutely gray. Gray as your bland countertop. And all over. He was gray on his face, he was gray on his arms, he was gray on his fingernails, he was gray in the sclera of his eyes. And initially, you see this guy come in gray and reported by EMS as being all gray. You think he's real hypoxic, and he's like 88% on a couple liters. Not terrible, but certainly doesn't account for this really abnormal discoloration. So we did some investigation, and it turns out that he has a really chronic condition. Anyone want to, if you take a look at these pictures, these are examples from the internet of some of the similar symptoms, but truly entirely gray, including sclera and nail beds. Anybody have a thought of that? Okay, so he's hyperpigmentation from?
I forget what, it was antibiotic.
It's a medication, it's an antibiotic. We don't, so it's in a class of drugs we don't typically give kids because it stains teeth and growing bones. What class?
Tetracycline?
Yes, a tetracycline class. This guy was on minocycline. So minocycline's used for a couple major different reasons. Typically we use it for acne or sexually transmitted diseases because it's a broad spectrum antibiotic, gram positives and gram negatives. But it's also used in different other conditions. Interestingly, it has some neuroprotective effects, so it's being used. There's some good literature to support things like Huntington's chorea and amyotrophic lateral sclerosis or Lou Gehrig's disease, or some spinal cord injuries, dementia, Alzheimer's, but also used in different types of autoimmune disorders, things like scleroderma and rheumatoid arthritis. So this guy was being used for rheumatoid arthritis. The problem was, and the problem that happens with these folks, because this is one of three types of Minocycline-Induced hyperpigmentation. There's type 1, 2, and 3. This is a type 3 where it's total body and it's irreversible. It has to do with prolonged use over a period of time. This guy was using it for 11 years. And his physician either knew about it or didn't monitor it, but as the hyperpigmentation develops, it's irreversible. With a type 1 and type 2, which are kind of patchy, or type 2 is just forearms and legs, that is reversible over time with discontinuation of the medication. So it was just an interesting case, seeing some of the side effects. Just the side effects that typically people manifest with minocycline: dizziness, vertigo, nausea. But this was a really remarkable and striking case, just to see the patient come in who's hypoxic and totally gray in appearance. So drugs are not benign.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.